My name is Marc Darrow. I practice prolotherapy. I've treated thousands and thousands of patients over the years. The reason I do prolotherapy, it worked on me and it works on my patients. Prolotherapy is a surgical alternative that reduces or eliminates pain. We inject the area of the injury, typically with dextrose and lidocaine, to stimulate an immune response to bring cells to the area and rejuvenate the tissue. The advantages of prolotherapy over surgery are many. Number one, it's less invasive. Number two, it's less expensive. And number three, there's virtually no recovery time. The video you're about to see contains prolotherapy in action. If you have any questions, feel free to contact me at 1-800-REHAB-10 or my website, www.drdarrow.com.
I've been suffering with my back since I was a kid. And I've had back surgery, and I've had injections, cortisone injections, and nothing seems to help it at all. Before, I'd go halfway down to the corner, half a block, and my legs were just like jelly. I had to lean against something. Now I walk up and back, so it's come along.
So this is a 71-year-old gentleman that complains of about 20 years of low back pain. About 13 years ago, he underwent back surgery. As you can see in the midline of his back, there's about a 6-inch scar, well healed. But his pain came back after about a year after the surgery. Now radiates to both his hips. He cannot bend over. He has difficulty standing up straight, has problems walking. So we began prolotherapy after I palpated or pressed firmly into the area that I'm injecting now. These are areas where the iliolumbar ligament attaches to the posterior pelvis. And this ligament, which is fibrous tissue that attaches bone to bone, in this case attaches the posterior pelvis to the L4-5 vertebrae, and that ligament is actually sprained. There's nothing exotic about this. There's no herniated discs to worry about. There's no spinal stenosis. It's just a simple ligament sprain. It's as if someone sprained their ankle, but because it's in the back, doctors often make the mistake of doing surgery when it's not needed, and I think that's what happened in this case. I think this patient is getting good relief from prolotherapy from what he tells me.
I've had about 4 treatments, and I don't stop taking my pain medication. I haven't taken that for about a month, so that's, it's a good sign.